Well, it gives me great pleasure now to introduce the New South Wales Mental Health Commissioner, J.Feneley. John is deeply committed to the recovery approach for people living with a mental illness and to the focus on the individual's needs. And he has been a key leader in the development of the Living Well, a strategic plan for mental health in New South Wales 2014-2024. Would you please welcome J.Feneley?
Thanks, Julie. Could I just commence by acknowledging the Gadigal people of the Eora Nation, who are the traditional custodians of the land, and pay my respects to their elders past and present. And thank you, Donna, for that wonderful welcome to country. And can I just acknowledge, as Mental Health Commissioner, that to the extent that our community was to embrace Aboriginal community concepts around social and emotional wellbeing, we would all be a lot better off. And I think we learn every month more about why those approaches are so well aligned to what we need to achieve. Could I also acknowledge those of us here today who have a lived experience of mental illness and those who offer hope and support as carers and family members. Ultimately, your wishes are what the New South Wales Mental Health Commission is all about, and we work closely and perhaps most predominantly with lived experience in terms of making sure that we're guided towards a path which will take New South Wales away from the history of discrimination and stigma, which of course there's probably no other area where much more acutely defines those problems than the area of BPD. So it really is a great pleasure for me to be invited to be here today to open the 6th annual National Borderline Personality Disorder Conference. And the very fact that we can say 6th annual conference is a remarkable thing because if we change the way people think, we will change the way people act. And when I say that, I'm not talking about those of us in the room who have a history of mental illness or their families and carers. I'm talking about those who make decisions about where resources go, and also our own community's acceptance of difference and its willingness to live comfortably with difference and to appreciate the richness of that difference. So it really is a testament to your efforts as a community of interest, the fact that we're now 6 years in to this conference. And I really want to acknowledge today the clinicians and carers, of course, who are working in this space and who have doggedly stuck with this space to champion its cause. But most of all, of course, I really wish to acknowledge those who have a lived experience of BPD and the courage that you show by participating in this dialogue, because the more we increase understanding and share information, the more rapidly we'll move towards a system which fundamentally gets BPD and fundamentally gets the impact on the lives of people and provides the services that are required. Can I say, as Mental Health Commissioner, I've noted quite early in the piece the sort of wrong-headedness of some of our approaches. We were doing many things around what we think is acute episodes of illness, but we were so often forgetting the person at the centre of that. We were so often dealing with a system in my own family history where there were a lot of doctors where it was commonly said that the person with BPD was the heart sink patient. And that casual discrimination and that casual disregard that would say, there's nothing you can do for them. Let's move on to those that we can actually work effectively with. And as with so many things in other areas of disability, our notion of what is a problem or what is disability is simply a reflection of our failure to respond appropriately, sympathetically and empathetically to the needs of a group of people. And once you do, of course, our notion of what is a disorder and our notion of what is a disability quickly varies because it's us, not them, that needs to change the way in which we approach these issues. So I'm really also pleased to acknowledge that I think 3 years ago to today, I think it was, that the Australian Borderline Personality Foundation was launched and really took on that challenge of addressing our community's attitude to this space and to try and increase understanding around it. And as I say, I saw this fairly early in the piece, and we're into our 5th year now as the Mental Health Commission, and one of the earliest opportunities I had was to meet up with Bryn Grinia and Project AIR. And I think I had a fairly deep understanding of the nature of the challenge. And I like to think in this space there are a couple of rock stars, and I think Bryn Grinia and Project AIR are undoubtedly rock stars in this space. And we should really celebrate the power they've brought to this space in terms of coming at this issue like any other issue, scientifically and with the evidence, and convincing those who are perhaps suffering most from prejudice and discrimination in this area, and that is our treatment services, to show them that there is a pathway through this. But to do that, of course, we have to grapple with our federation and the fact that so often in our federation, the responsibility between state and federal ministers and funding arms actually bedevils our approach to challenging those more challenging and difficult issues that require persistence. And what we know about BPD is it requires persistence. We have to walk together for a longer period of time than we're used to provide those services, and Project AIR so beautifully demonstrates that approach and gives us hope, because what it demonstrates, of course, is what we can achieve when we do that. And I'm really delighted to say that in Living Well, in 2014, the government committed to increase funding in relation to Project AIR, and although I know Bryn's going to talk about it, it is really quite a remarkable thing that now that we have clinical guidelines and we are increasing the understanding of how approachable and how solvable and how treatable this condition is, and how much we can improve the lives of those who experience it and those around them, that we will really change things. And what's happening, I'm told by Bryn, is that we would expect, I think within the next 5 years, that Project AIR and the clinical guidelines associated with that will reach across New South Wales. Can I tell you, it is a remarkable achievement, and it will completely upend the nature of our services. And with that, what it will really do is allow for those really critical services to be more accurately directed to greater need. So we currently waste vast sums of money by not dealing with these issues appropriately. Project AIR and the methodologies that go with it will see us embrace this and turn around this system once and for all. And I can tell you, it is the fundamental building block of a decent society that is committed to the well-being and mental health of its community. And it's a fundamental building block for a decent mental health system, that we respond appropriately and frankly for as long as it takes. And that's what the federal government needs to embrace in relation to our MBS and PBS system, that we need to stick with this for as long as it takes. Now, can I say, amongst other duties today, I'm really delighted to be speaking also with J.Harms, because not only do we have the Australian Borderline Personality Disorder Foundation, but today I know we're going to celebrate the launch of the New South Wales branch, and so I welcome Jonathan to the stage.
A round of applause, please, for J.Feneley. Come forward, Jonathan. Can I just first of all ask you to give a clap and stamping feet to J.Feneley, because he really understands, and that was a wonderful presentation. So clap and stamp, please. Thank you. And it's my pleasure to welcome J.Harms, the CEO of the Mental Health Carers New South Wales, the peak body for carers of people with the lived experience of mental illness in this state. Jonathan's background is as a lawyer with extensive experience in state and federal governments. But since becoming CEO of Mental Health Carers New South Wales, among many things, he's created carer peak advisory committees and also a carer support worker forum to involve support workers and carers in the work of the organisation. So another round of applause, please, for Jonathan.
Well, thank you very much, Julie, and thank you, John, for the warm introduction. It's great to have a commissioner who's always so keen to support community events and the participation of people with experience of mental illness and the people who care for them at every level in the reform process for our mental health system under the Living Well strategic plan. I'd like to acknowledge that we're meeting on the traditional lands of the Gadigal people of the Eora Nation and pay respects to their elders past, present and emerging, and also to people with lived experience of mental ill health and their carers here today. I know that trauma can have many impacts on a person's development, from alcohol and drug issues to personality disorder. We see many of them manifested across the community, and by coming together to provide the services and support that they need, we can help them and we can help our community to have the best possible mental health to resolve these issues and to get on with their lives and enrich our community, because people with experience of personality disorder are often very sensitive people. When we hosted the third national conference and helped launch the National Foundation with Alan Fells in 2013, it was very clear that the people who really need to be most prominent in all of the developments that as we go forward and in the work of our foundations and institutions are the people with that experience whose needs we need to get a lot better at meeting. So I would like to acknowledge that the foundation has had a number of meetings, and we have selected a small committee to commence the work of the foundation. We have Jenny Learmont, a board member of Mental Health Carers New South Wales, Larry Billington, who's up the back, and we've also, myself of course, have also had an expression of interest, which was very exciting, just yesterday from a very prominent consumer carer advocate, Eileen McDonald, who's actually on the National Mental Health Consumer and Carer Forum, who would like to join the organising committee for the New South Wales branch. So those are people with great skills, knowledge, experience, and I think that with the committee that we've got and the membership, which includes many members of Project AIR and local health district mental health service staff, we're going to have quite a dynamic organisation that's able to run some great projects, including conferences like this, to support the development of services that meet the needs of people with BPD and their families and carers. I think we should acknowledge that New South Wales has made some great progress in the support of people with BPD, and the Project AIR was started under the guidance of the previous chief psychiatrist when he took office, by asking the directors of local health districts, what are we doing badly in mental health, what are we missing? And the access of people to psychological support and complex psychological therapy over an extended period of time was one of those key missing areas, and in particular when it was addressing personality disorder. And that's where Project AIR got started. But it's not the first work that has been done around personality disorder in New South Wales, because of course the John Hunter Institute in Newcastle has been going for probably, well, I know it's been going for longer than that, at least just in that area. And indeed, it's important to remember that while Project AIR provides that umbrella and is crucial in providing a framework and support for clinicians that have those skills in each LHD, it's actually up to the local health districts to decide the sort of investment, the sort of services that they're going to make in providing psychological services in the community. And the John Hunter Institute in Newcastle has been going for years. It's been providing that therapy, so it matches in very nicely with the sort of structure that's evolving in New South Wales. But the reason I raise it is because Professor Chris Wilcox will be speaking about the impact of making those services available with a decent amount of scale in a region. And it seems, well, from our informal discussions anyway, that it's not just improving the lives of people who actually have access to the amount of treatment they need to achieve a result. It's actually reducing the incidence of personality disorder in that area as far as they can tell, because people aren't traumatising each other, people are learning new skills and passing them on. So it's a really positive thing for the Hunter area, although that's had a few wins recently with the NDIS being rolled out, the Partners in Recovery Consortium working very well, and we're seeing some transformation in the way in which mental health services are being delivered, which has some learnings for the rest of the nation, because of course the NDIS will be rolling out across the rest of the state. There is supplemental funding for mental health that's going to be funnelled through the primary health networks, which will allow things like the Partners in Recovery or other similar programs to be delivered. And in fact, there's going to be a key role for people with lived experience to play in identifying the gaps that need to be filled and the services that need to be commissioned. So it's not just the local health districts, although they will obviously provide a lot of the more complex and resource demanding services, but there's also scope for ventures, collaborations with the primary health networks to access new funding and help imagine new kinds of facility that more specifically address psychological disability and support needs, so that we are able to keep people away from emergency rooms, keep people from cycling through processes where we say a revolving door to nowhere instead of no wrong door often. So we can actually provide the support, the psychological support in the community that allows people to achieve the fantastic recoveries that we know are available once that support is provided. So I will just wrap up my remarks by saying that Mental Health Carers New South Wales has been very happy to support this event, both in 2013 and again this year. But as far as taking credit for the donation of the Door Prize, that excellent book, The Girl in the Mirror, I should acknowledge that a close supporter of Lumi Winterson, the author of The Girl in the Mirror, who was a person who actually experienced personality disorder, or acquired that label, as they say sometimes, she is actually going to donate those Door Prizes herself. And Satu Beverley, the supporter of Lumi, who I'm alluding to, is here today. So thank you very much for that, and we're very happy to be promoting that book as a great example of the sort of things that people can do when they're supported to participate in their community and to express their lived experience in a positive way. So thank you very much for launching the conference and our foundation today, Commissioner, and I hope everybody has a great and informative day and sees the prospects for hope that we have for a much better future for people with the experience of BPD and their families and carers. Thank you very much.